Hi friends, good evening and welcome back to my channel Mookambika Nursing. Friends, here we are discussing MNS exam previous year questions and answers. Also, I included important questions. So these questions surely will helpful for your exam preparation. MNS exam is on 14th January. So study well for the exam. We can see today's question. The first question, softening in the midline of uterus anteriorly at the junction of uterus and cervix is known as options. Option A, Ladin sign. Option B, Haga sign. Option C, Gould sign. Option D, Kolasma. And the correct answer is option A, Ladin sign. Softening in the midline of uterus anteriorly at the junction of uterus and cervix is known as Ladin sign. Second option, Haga sign is there. In Haga sign, the upper part of the body of the uterus is enlarged and the lower part of the uterus is soft and the cervix is completely fine in case of Haga sign. Third option, Gould sign is there, that is softening of the cervix. Here softening in the midline of uterus anteriorly at the junction of uterus and cervix, that is known as Ladin sign. And the next question, iron is stored in the body as options. Option A, transferrin. Option B, ferritin. Option C, ferrous sulfate. Option D, all of this. Iron is stored in the body as ferritin. Option B is the correct answer. Move on to the next question. Which of the following vaccine is contraindicated in pregnancy? Options. Option A, measles. Option B, rubella. Option C, mumps. Option D, all of the above. Among this, which vaccine is not given or which vaccine is not administered for pregnancy? Correct answer is all of the above. That is vaccines like BCG, mumps, measles, rubella, oral typhoid vaccines, Japanese encephalitis vaccine, influenza, all are contraindicated during pregnancy. The next question, purple blue tinge of cervix is known as options. Option A, Braxton Hicks contraction. Option B, Chadwick sign. Option C, Haga sign. Option D, Gould sign. Purple blue tinge of cervix is known as Chadwick sign. Option B is the correct answer. Chadwick sign is also known as Giacomo sign and this is visible at 8th week of pregnancy. The next question, which of the following can lead to greenish discoloration of amniotic fluid? Option A, lanugo. Option B, meconium. Option C, vernix. Option D, hydroneos. Greenish discoloration of amniotic fluid is due to the presence of meconium. Option B is the correct answer. Amniotic fluid, in case of RH incompatibility, it is golden color. In post maturity, it is greenish yellow or saffron color. In intrauterine death, it is dark brown or tobacco juice appearance. And dark colored amniotic fluid means there is an concealed accidental hemorrhage. Okay, here greenish discoloration is in meconium stained amniotic fluid. And the next question, vaccine for meningococcal meningitis provide immunity that lasts for about options. Option A, 2 years. Option B, 3 years. Option C, 4 years. Option D, 5 years. Meningococcal meningitis vaccine provide immunity which lasts for 3 years. Option B is the correct answer. Meningococcal meningitis vaccine is a conjugated vaccine and the dose is 0.5 ml given subcutaneously or intramuscular. Okay, it provides immunity last for about 3 years. And the next question, fresh frozen plasma contains options. Option A, RBCs. Option B, platelets. Option C, plasma protein and clotting factors. Option D, WBCs. Fresh frozen plasma contains option C, plasma proteins and clotting factors. 1 unit fresh frozen plasma contains 200 to 225 ml. This is one of the important point. And the next question, drug which increases the urinary excretion is known as. Options: option A antidiuretics, option B diuretics, option C laxative, option D vasopressin. Drug which increases urine output is known as diuretics. Okay, antidiuretics means which helps to control the production of urine by kidney. And the next question, the ability of the drugs to cause fetal damage is known as. Options: option A ototoxic drug, option B fetotoxic drug, option C teratogenicity, option D amniotic. Correct answer is option C teratogenicity. The drug which cause fetal damage is known as teratogenic agent. And the next question, tracheostomy suction pressure for adult is about. Options: option A 80 to 100 mm of Hg, option B 100 to 120 mm of Hg, and option C 60 to 80 mm of Hg, option D 70 to 100 mm of Hg. Correct answer option B 100 to 120 mm of Hg. Tracheostomy suction pressure for adults. And the next question, tracheostomy suction pressure for children is about. Options: option A 80 to 100 mm of Hg, option B 100 to 120 mm of Hg, option C 60 to 80 mm of Hg, and option D 70 to 100 mm of Hg. Here tracheostomy suction pressure in children, it is about 80 to 100 mm of Hg. Option A is the correct answer. And the next question, quarantine was first applied for which disease? That is the question. Options: option A HIV or AIDS, option B leprosy, option C TB, that is tuberculosis, option D plague. Correct answer is option D plague. Quarantine was given for plague firstly. And the next question, communicability of the disease is assessed by. Option A secondary attack rate, option B serial interval, option C generation time, option D incubation period. And the correct answer is option A secondary attack. Communicability means the ability of a disease to be passed from one person to another. Okay, how fast it is transmitting from one person to another, that is known as communicability. And the next question, which type of vaccine is MMR? Options: option A live attenuated vaccine, option B killed vaccine, option C toxoid, option D none of this. MMR is an example of live attenuated vaccine. Live vaccines include BCG, OPV, yellow fever vaccine, typhoid vaccines, influenza, live vaccines, rubella vaccines, mumps, measles vaccine, endemic typhus vaccine. All are live vaccines. The next question, immunity develops dash days after the administration of Japanese encephalitis vaccine. Options: option A 6 days, option B 10 days, option C 30 days, option D 90 days. Correct answer is option C 30 days. Immunity develops 30 days after the administration of JE vaccine. And the next question, the vaccine for yellow fever is valid till. Options: option A 3 years, option B 5 years, option C 10 years, option D 15 years. The vaccine for yellow fever is valid till 10 years. Option C is the correct answer. The approved vaccine for yellow fever is 17D vaccine. It is a live attenuated vaccine and the dose of vaccine is 0.5 ml and it is given subcutaneously. The next question, to avoid an error while measuring blood pressure, the nurse should. Option A elevate the hand of the patient, option B put tight cuff, option C put loose cuff, and option D read at the eye level. Correct answer, read at the eye level. The value of BP should be read at eye level. And the next question, propulsive and expulsive phase seen in which stage of labor? Options: option A first stage, option B second stage, option C third stage, and option D fourth stage. propulsive and expulsive phase is seen in second stage of labor. Second stage of labor means full dilatation of the cervix and expulsion of the fetus. So expulsive phase occurs in the second stage, and the propulsion means full contraction of the uterus. Okay, that is the propulsive phase and expulsive phase seen in second stage of labor. And the next question, the amount of protein intake to be maintained during renal failure is options. Option A 40 to 60 milligram per day. Option B 20 to 40 milligram per day. Option C 60 to 80 milligram per day. And option D 80 to 100 milligram per day. And the correct answer is option B 20 to 40 milligram per day. In case of renal failure, the protein intake should be minimized or protein should be taken by low quantity because the protein is metabolized into blood, urea, nitrogen and other metabolic waste. So it is excreted through the kidney. Here kidney is already failure. So to decrease the workload of the kidney, the protein intake should be minimized to 20 milligram per day. Here 20 to 40 milligram is there. So that is the correct answer. And the next question, urine output less than 100 ml in 24 hours is known as options. Option A anuria, option B oliguria, option C polyuria, option D dysuria. Urine output less than 100 ml in 24 hours is known as anuria. Option A is the correct answer.